1 in 4 adults in America suffers from a diagnosable mental disorder over the course of a year. The first step to reversing this trend is understanding what mental health is. In today's video, we're first going to be going over a definition of mental health, looking at its history, and then looking how to cultivate better mental health. So the overall health of our brain breaks down into two categories. One is neurology and the other is psychiatry. Both are professional medical degrees. Neurology deals with the more physical aspects of the brain and what can happen to the brain when structural damage occurs, such as a stroke or epileptic seizures. They also deal with nerve disorders. Psychiatry deals more with the mental aspect of the brain and deals with disorders that have little to no physical change on the brain, such as schizophrenia, bipolar disorder, depression, and anxiety. Really, the key to understanding mental health is looking at it as more of a spectrum. Our location on the spectrum is determined by two factors. One is going to be nature or our genetic makeup. The second factor is nurture or our upbringing. Those two factors determine the general area on the spectrum of which you will start at. And throughout the day, you will go back and forth and kind of fluctuate. Throughout your life, you will fluctuate as different events transpire. It's perfectly normal to fall on one side of the spectrum occasionally, but prolonged periods of sadness and emotional turmoil can actually indicate an injury to your mental health. So usually when people talk about mental health, they're talking about the psychiatric branch of brain health. Because there are little to no physical indicators of mental health disorders, psychiatry has had to face a unique set of challenges in comparison to other medical specialties. This led to psychiatrists developing remedies and treatments for mental health that really had little to no effect. Perhaps the most famous person that lands in this category is the psychiatrist Sigmund Freud. So Freud saw psychiatry through the lens of Darwin's theory of evolution. He believed that every single aspect of human behavior could be attributed to our need and desire for reproduction. This led him to develop some very criticized theories such as the castration complex and the Oedipus complex, both dealing with the psychosexual development during adolescence. Although many of Sigmund Freud's theories have kind of faded with history, his theory of the unconscious mind has remained intact. In fact, in 1890, Sigmund Freud developed his theory of the unconscious brain and formulated his own school of thought called psychoanalysis. Psychoanalysis was a method for revealing the unconscious mind in order to better understand the patient's hidden complexes. Psychoanalysis was the focus of psychiatry for almost a century after its formation. Its main innovators were living in Germany and other places around Europe. So right after World War I and World War II, many of them moved to the States, and it completely revolutionized psychiatry in America, focusing almost exclusively on psychoanalysis. However, the therapy proved rather ineffective, and mental institutions and hospitals were overflowing with patients in the early 1900s. All psychiatry wanted at this time was some kind of remedy, some kind of treatment to give to these patients. Unfortunately, this desire for a new treatment and a remedy to all these different mental illnesses led to some of the most inhumane practices in medical history and forever will leave a mark on psychiatry. Leading up to the 1950s, lobotomies were performed on unruly patients. Fevers were purposely induced despite the 25% death rate. Luckily, soon after these practices gained popularity, they were replaced by a new remedy in the arsenal of psychiatry, and that was medication. Shortly thereafter, scientifically backed talk therapies started to form, such as cognitive behavioral therapy, or CBT, that is still used today to help patients deal with anxiety disorder and ADHD. Looking back at the history of psychiatry, it does not look good. Psychiatry has come such a long ways from the late 1800s and the early 1900s. Today, mental health has become more and more focused in every single person's life, as it should be. So I want to cover a few things that can help foster better mental health. First thing is you have to understand that ignoring your mental health is not an option. Mental health really is similar to stretching a muscle. If you stretch your muscle every day, you will have incredible range of motion and good mobility. But if you refuse or kind of neglect stretching your muscles, maybe nothing happens, but maybe you get extremely tight areas in your body that cause back pain and knee pain. And it's similar to mental health. If you don't take care of it on a daily basis, or at least pay attention to it every once in a while, it can come back and really affect you. So if you really think that your mental health hasn't been doing well lately, the first thing you need to do is have a conversation with somebody about it. Second thing I want to mention is good mental health is a routine, it's not a destination. There's no such thing as perfect mental health, and it's not something that you acquire. Mental health is something that you practice and work on. It's a mixture of positive reinforcement and the development of various healthy coping mechanisms. Coping mechanisms sometimes aren't learned through child development, just because every single person is raised differently with different experiences and with different parents. And so making sure you know and understand different coping mechanisms is really a cornerstone to developing good mental health. Lastly, don't be embarrassed. Mental health has developed a huge stigma around it due to its rather barbaric history that we just discussed. However, as more information comes out and more scientific studies are done, mental health is further and further understood, and as a result becomes less scary. In reality, it really is like a part of our body. Occasionally we get injured, maybe a cut here or a bruise there, or maybe even a broken bone. The same thing can happen to our mental health. We are resilient animals, and a bruise or cut can be healed almost every single time if the right steps are taken. But something like a broken bone can lead to severe disability if it isn't taken care of. And it's the same thing with our mental health. One of my New Year's resolutions for 2021 is to focus more on mental health. I'm not struggling with anything in particular other than maybe being a stressed college student, but I want to fortify my mental health and take some time to focus on it a little bit. If you share that same goal or are interested in learning more about how you can improve your own mental health, I'd highly recommend subscribing. I'm going to be reading and learning more about mental health throughout the early part of this year and releasing videos that coincide with that. So thanks for watching. I'll catch you on the next one.